the Ghana Red Cross find ourselves in Echo in the central region, Cape Coast precisely. And as you can see, it's a beautiful ambience here. We can see the Cape Coast Castle on our far left. Now, Cape Coast is known now as one of the hotspots when it comes to cholera in Ghana. The outbreak happened sometime last year in October, where we saw some in the central, in the Ashanti, in the western, eastern, and greater Accra regions of Ghana. And so we are here, the Red Cross, just as we respond to emergency medical situations, we're here to offer our support and also put on our bed to make sure that this outbreak becomes a thing of the past as soon as possible. So here with me is Mr. Ernest, who is the health coordinator at the Red Cross, and he is in charge of this entire operation. As you can see behind me, there's a beautiful setup, and so let's get to it and know what this is even all about. Mr. Ernest, good morning. Tell us, why are we here? What is all this about?
All right. Yeah, so this is ORP setup. That's Oral Rehydration Point.
Oral Rehydration Point. Okay.
Now, we set up this when there is a cholera outbreak, and then where it serves as a first aid point for the community. People may be complaining about diarrhea and then all sorts of things concerning cholera.
Okay.
So once they have that diarrhea or so, this is the first point of contact before they will go to the hospital. Because once you have the diarrhea or you are vomiting, you lose a lot of water.
Yes.
And then the best thing that you have to do as a first aid measure is to get the ORS. So that you can actually, so we just give them a temporary measure here. Then we refer them
more like first aid.
It's first aid.
First aid.
We don't keep them here. And they just go to the hospital. Sometimes the hospital is a bit far from here. And that's why it's good to set up in a community where there's a cholera outbreak so that they will get this first service before they get to the hospital.
Okay. Is this a normal thing that you do at the Red Cross, or is this any special event or case that you're setting this up for? What exactly is it like?
All right, so for the ORP setup, some of the health facilities they have it, but that one is more in the hospital. But ours is more in the community to serve the people before they get to the hospital. So this is a Red Cross initiative. It's not only the ORS that we are giving them, but then we are also giving them education, what they should do. They should wash their hands. They should actually follow the hand hygiene protocols and other protocols in the cholera outbreak.
Okay. So we're still here in the community, and standing by me is Mr. Seth, who is the coordinator for this particular setup, the ORP setup. And he's to take me through what exactly is done here, what this setup is actually all about. And so, Mr. Seth, it's up to you. What are we doing here this morning?
Good. So this is ORP corner.
Good. The ORP corner.
Yes.
Okay.
Good. So it is set for cholera patients. Good.
Cholera patients.
Yeah.
Okay.
So it has been divided into 3 segments.
Okay.
Yeah.
Okay. So this is where all the action happens.
Yes.
All right. So from washing your hands to taking your details to being administered with ORS, then you come to the waiting corner. You get your ORS, you sip. If you have to use the washroom, you do use the toilet facility. And then you're coming back, you wash your hands, and stay. At any point, if you observe and feel it is severe, you refer the person to the hospital. Beautiful, beautiful, beautiful. Okay.
And so volunteers are on standby, arranging a transport for the cholera patient to a nearby hospital.
Okay. So once I wash my hands, I go back there. What are these for? I see these buckets here as well.
Yeah, these buckets are a solution of chlorine.
Oh, okay.
Yeah, for disinfection. A solution of chlorine for disinfection.
Okay.
Yeah, so.
Oh, those who are mobbing around. Okay.
Those are mobbing.
Okay.
Good.
All right. Yeah. I get that. And this is done by the Red Cross?
Yeah, it is done by the Red Cross. So we are all Red Cross volunteers.
Right.
We trained by Red Cross to administer this procedure.
Okay.
Yeah, to cholera patients.
So when you are here and the community members maybe are a bit hesitant to come out, what do you do then?
They will not even be hesitant, because once you've gotten the cholera disease, you know the symptoms of cholera. Yeah, you'll be vomiting and then be running. And so this thing is it's not like the vaccine that you say you will not come for it. You will bring yourself. Yeah, your people will bring you. Yeah, so during ORP procedures, things of hesitancies are not being seen. Yeah, because once you get the disease, you come yourself. Yeah.
All right. Thank you so much, Mr. Seth, for taking us through the ORP corner.